I am Dr. M.S. Reddy, consultant psychiatrist in Hyderabad. I run the clinic, Asha Bipolar Clinic at Asha Hospital, Hyderabad. I'm particularly interested in this, like mood disorders, as I've told that bipolar disorders is one disorder which fascinated me. So in the last 2 decades, I've been working more and more with a specific focus on this particular group of disorders, what initially was called as manic depressive psychosis and bipolar disorders. Right? With about 4 decades in my clinical experience and the 2 decades in specific focus in mood disorder, this bipolar disorders, there are certain things which fascinate me. There are certain things which disappoint me also in bipolar disorders. But this is one which I would like to talk about, explain about, bring more and more awareness about. To tell you, bipolar disorder is the most unique disorder, not just in psychiatry, the entire medical sciences. I don't think in medical science, under whatever may be the specialty, there is a diagnostic entity where the presenting symptoms are exactly opposite. Two different kinds of symptoms, don't like described under one category. Depression, you all know that patient is sad, dull, blues, and down in the dumps. Mania is on the top of the world. Both this depression mania together come under one particular disorder, two different poles. That is what is bipolar disorder. Depression, all of you know what are the manifestations, what are the symptoms of depression. Mania is one fascinating thing. Here the person is happy, very happy, extremely too happy to grandiose. A lot of times people ask me, Dr. Reddy, why do you have to treat when somebody is too happy? But the happiness is something like this. These people are grandiose. They tell me that I have not contested in the last election, otherwise, our Prime Minister Narendra Modi would not have won. COVID-19 is something which I can manage, Dr. Reddy. I have come to this earth. God has created me on this earth with a specific purpose. I am a designer person, Dr. Reddy, limited edition designer person. This is the kind of grandiosity they have. Don't you think they need treatment? All of us need 7, 8 hours of sleep. When you tell this patient that he needs some sleep, he said, what nonsense. I need only 2 hours of sleep. You people are wasting your time sleeping for more than hours. I use that time, another 6 hours for my, whatever the purpose. I do a lot of good things I do. This is a kind of thing they talk about. And tell you, they don't have any insight. That means that they never accept that they have any specific disorder or even a minimal problem. These are one of the biggest problems we have. They talk all these things, they spend a lot of money, they're grandiose, they're lavish, and do the kind of a planning they do is, my God, sometimes the family is financially ruined. They don't have insight. Unfortunately, in today's psychiatry, we don't have any laboratory tests, whether it is a blood test or like a neuroimaging, no test which confirms and tells. He asked me, show me the test where I'm having a disorder. That's biggest problem to deal with this person. And also the families are lost. 0.6% of the population on this earth, they have bipolar disorder. In the general population, it's 0.6%. As I was telling that, if one of your parent, again the genetic risk, one of your parent has a problem, it goes up to 10%. If you're a twin who has got affected with this, it goes up to 50%. Why I'm repeating this is this: bipolar disorder, most of the psychotic disorders are largely genetically, like vulnerability comes in that. So with this is the now like and again here, the age of onset, 40%, 50% of people, the age of onset is around the age of 20. It's almost about 100 years back, around like 1920s. The famous psychiatrist by name Emil Kraepelin has made a classification of all the psychoses into two groups. One is mood disorders, thought disorders. Mood disorders are bipolar disorders, thought disorders, schizophrenia, other disorders. The classical feature here is episodic. When you say episodic, it occurs in episodes. That's the beauty of bipolar disorder. This is a serious mental disorder, but this is a good prognosis. Episode recovery from the episode is there, but unfortunately, there are recurrences. Recovery is the rule, recurrence is the rule. So, as a clinician, what is that I have to do? treat the like episode early recovery. Secondly, that prevent the recurrence. See that the patient will never have the next episode. That's what the treatment goal. Most of the times we may not be able to achieve that, but we try our best to do that. Once again, here the suicidal risk is very high. About 15% of the patients with bipolar disorder, they end their lives committing suicide. Bipolar disorder is almost equal in both men and women. But again, starting at the age of 20, you have seen when somebody in that manic phase, what kind of havoc he can create for himself and to the family. Depression, once again, the risk of the non-productivity and then suicides. Again, one is genetic, second thing is once again neurochemical disturbances in the brain. Whether you talk about dopamine or a serotonin or maybe connectivity problems in the brain, it's usually the neurobiology which plays a major role. Treatment is mainly the medicines. We have some drug called lithium, which has got a good prophylactic effect. It works on the current episode and also the prevention of the episodes. Early treatment, early recovery, prevent the recurrence, prevent suicide. This is going to be the most important motto in the management of bipolar disorder. At this point, let me tell you, generally we talk about stigma in psychiatric disorders. But bipolar disorder, mood disorder, of late, some of the especially youngsters, millennials who Google and then Google doctor, that they walk into my clinic nowadays say that, Dr. Reddy, I have mood swings. I think I have bipolar disorder. Please let me tell you, mood swings, the so-called mood swings, most of the time people talk about are normal mood swings. So everybody who is slightly feeling sad and slightly, like and happy, they are not bipolar disorders. Mood swings are normal. And in some personal disorders, they can be slightly on the high intensity. So they are not bipolar disorders. Bipolar disorders, as I told, at 0.6%, and then the severe mood swings which can happen, which create the problem. But end of the day, each episode the recovery is a rule, and they become completely normal. It's like epilepsy, it's like asthma. Asthmatic episode you have, and after that, next 2 3 years you're all right. You have one fit, and then next 1 2 years you're completely free of it. It is that kind of a disorder. Treatment is very, very effective. Treatments are there for the management of the episode. Even recurrences we can prevent. This particular disorder, the awareness is again, the problem is awareness. Considering the 15% suicide risk, people should have a suspicion about it. Walk to your family physician first and then go to the psychiatrist. Thank you very much.